This is a video summary of Chapter 11, Systemic Family Counseling and Therapy. For the text, Theory and Treatment Planning in Counseling and Psychotherapy by Diane Gerhardt. My name is Priscilla Gallegos. Lay of the land. Systemic approaches were developed in the 1960s. Originally, they were created for work with couples and families. Systemic approaches represent a unique set of theories that conceptualize an individual's symptoms as arising within family and relational dynamics and serving to balance the family dynamics in the same way. Systemic family approaches can be used by psychologists, counselors, social workers, and family counselors. General systems and cybernetic systems theories. General systems theory and cybernetic systems theory are closely related, but what sets them apart is that cybernetic systems theory is more focused on social systems. Cybernetics, homeostasis, and self-correction. In the Greek language, the word cybernetic means steersman. Cybernetic systems steer towards homeostasis. Homeostasis is not static but dynamic. In order to maintain a sense of stability, systems must be constantly in flux. Maintaining stability means having the ability to self-correct. Negative and positive feedback. Negative and positive feedback is easy to understand. Remember, any new information, good or bad, is positive feedback. No new information, more of the same, is negative feedback. Positive feedback loops are created with good or bad news. Positive feedback loops result in the following two options: A, return to homeostasis, or B, creating new homeostasis. Usually, a system's response to positive feedback is to try to return to the original homeostasis as quickly as possible. First and second order change. When returning to the original homeostasis is impossible, a second order change is created. Second order change refers to when a system restructures its homeostasis in response to positive feedback and rules that govern the system shift fundamentally. First order change, of course, refers to when the system returns to its previous homeostasis after positive feedback. It is important to know that second order change is not always necessary in counseling. First order change makes logical sense. Second order solutions seem odd and illogical because they introduce new rules into the system. One cannot not communicate. Since all behavior is a form of communication, and it is impossible to not be engaged in some form of behavior, at least while we are alive, it follows that we are always communicating. It is essential that counselors study the system's behavior and examine the anatomy of the communicated messages. Double binds. Double binds are explained with the following three ingredients. Two people are in an intense relationship that has a high degree of survival value, such as familiar relations, friendship, religious affiliation, doctor-patient, counselor-client, social norms, and so on. Within this relationship, a message is given that is restructured. That is structured with A, primary injection, request or order, and B, a simultaneous secondary injection that contradicts the first, usually at the metacommunication level. Finally, the receiver of the contradictory injunctions has a sense that he or she cannot escape or step outside the cognitive frame of the contradictions, either by metacommunication, commenting on the contradiction, or by withdrawing without threatening the relationship. The receiver is made to feel bad or mad for even suggesting there is a discrepancy. An example of a double bind is when a mother gives her son a cold, distant hug. Command aspect suggests distance, and then asks, "Why are you never happy to see me?" Report aspect suggests closeness. Family as a system. Most importantly to the systemic approaches is viewing the family as a system. These are the propositions listed. No single person orchestrates the interactional patterns. All behavior makes sense in context. No single person can be blamed for family distress. Personal characteristics are system dependent. In a nutshell, systemic counselors always view a person as inherently part of a larger relational system which include the family of origin, family of procreation, social communities, and broader societal groups. Systemic counselors radically propose that a person's problems or symptoms are inherently related to the dynamics of these systems. Systemic counselors should remain neutral without placing the blame on any particular individual. They conceptualize families using two paradigms: A, family structure, boundaries, hierarchy, and subsystems, and B, systemic interactions patterns, repetitive interaction cycles related to the problem. Systemic counselors focus on strengths and never see an individual or family as dysfunctional. Enactments. Enactments are research-based and commonly used in different types of counseling. Mastering enactments is vital because couples and families will start arguing during the session whether asked or not. Therefore, a counselor should know how to handle difficult moments. Counselors prefer enactments because many individuals may say they are one way but behave differently. Enactments occur in three phases. Phase 1, tracking and mapping, observation of spontaneous interactions. Phase 2, eliciting interaction, the invitation, can you reenact what happened last night? And Phase 3, redirecting alternative transactions. Ways that systemic counselors redirect interactions include the following: reduce enmeshment, reduce disengagement, reduce triangulation, clarify boundaries, alter pattern with individual, increase parental hierarchy. Overview of treatment. Systemic counseling focuses on resolving the problem, with the counselor imposing no other goals or agendas. Using two lenses, systemic counselors conceptualize interaction: A, identifying problematic interaction sequences, and B, mapping family structure including boundaries, hierarchy, and coalitions. The process of systemic counseling. Step 1. Assess the interactional sequence, family structure, and associated meanings. Step 2. Intervene by interrupting and redirecting the interactional sequence. Step 3. Evaluate outcome and client response. Step 4. Interrupt the new pattern. Who's involved? When possible, counselors prefer to begin counseling with the person most significant to the identified client in attendance, often family or partner, to assess the relational system. When it is not possible to have the family and only one individual is present, the counselor still assesses the entire relational system. Counseling relationship joining. Systemic counselors become a part of the system. They show respect and learn new rules. They accommodate to each family style in a way that they talk like the family and express themselves like the family. They sort of join the family. Respecting and trusting the system. Systemic counselors respect the system of which the client is a part of and view it as an entity that has its unique epistemology or way of knowing and understanding the world. Counselors trust that the system will redirect itself without the counselor having to force change on the system. Neutrality and multi-partiality. The systemic counselor takes no sides, but instead makes sure that every member is heard and honors all perspectives. Neutrality in relation to clients. The systemic approach emphasizes the pragmatic effect. If after the session the client goes home unable to say what side the counselor was on, then they have experienced the pragmatic effect. Neutrality in relation to the problem. More abstractly, counselor neutrality also implies not getting overly invested in particular meanings, descriptions, or outcomes. This also means that the counselor not rigidly hold on to his or her own hypothesis and case conceptualization ideas. Maneuverability. System counselors do not use a one-size-fits-all approach to developing the counseling relationship. Counselors should depend on A, the relational rules of the particular system, and B, the presenting problem. The counselor may play the role of an expert or may take a one-down helpless stance, depending on which stance seems to help clients reach their goals more quickly, not on what the client simply prefers. One-down stance. The one-down stance operates in two different levels. At one level, the one-down stance is sincere and genuine. At second and more common use of the one-down stance refers to the counselor paradoxically claiming, "I am not sure if I am able to handle such a problem," in order to motivate clients to change. Social courtesy. The initial stage of counseling should include the counselor engaging in casual conversation, example, weather or traffic. This helps the client feel comfortable and reduces any sense of shame. Counselors should always properly greet all members of the family. Spontaneity. Counseling spontaneity refers to the ability to flow naturally and authentically in a variety of contexts and situations, but it does not imply a throw caution to the wind and say what you please approach. Observation team. A trademark practice of systemic approaches, counselors work with an observation team to better observe systemic patterns. The viewing case conceptualization and assessment. Strengths. Systemic counselors are strengths-based and strongly advocate on avoiding labeling families or individuals as dysfunctional. Family life cycle of development. Family is viewed as continually growing and changing due to the unexpected life events and predictable stages of development. Interaction patterns and behavioral sequences. Interaction patterns and behavioral sequences are assessed through 4 stages. 1. Things being normal homeostasis. 2. Tension rises, positive feedback. 3. Symptom, positive feedback. And 4. Tension subsides, self-correction. Role of symptom. Systemic counselors view symptoms as playing a role in maintaining relational homeostasis and sense of normalcy. Subsystems. Families are viewed as systems with multiple systems within them. Triangles and cross-generational coalitions. Triangles form when there is a third person pulled in to reduce tension. The third person usually takes a side. When this happens between parents and a child as a third person, it is cross-generational coalition. Boundaries. Boundaries are rules for managing physical and psychological distance between family members, defining the regulation of closeness, distance, hierarchy, and family roles. There are clear boundaries, enmeshment and diffuse boundaries, and disengagement and rigid boundaries. Hierarchy. The parental hierarchy refers to the power differential between the parent and child and the parent's ability to manage the child's behavior. Complementarity. This refers to rigidly adopted patterns of opposite roles in a relational system. 4 steps for setting systemic goals. Step 1. Clearly define the problem. Define the problem in concrete behavioral terms, including the actions and reactions of all involved. Step 2. Identify prior attempted solutions. Step 3. Develop a clear prescription of preferred change. Develop a behavioral description of the things to be changed. Step 4. Develop a systemic treatment plan. The doing. Interventions. Systemic reframing. Specifically, systemic reframes illuminate how a client's symptom is a part of a larger interactional pattern. Circular questions. Circular questions make overt the systemic dynamics and interactive patterns in the system, and by doing so, they inherently reframe the problem for all participants without the counselor directly proposing a reframe. Each morning from 8 to 8:15. Expanding and challenging the client's worldview. This involves using the symptom, not asking clients to relinquish it, and recontextualizing, stretching, and/or reordering it to resolve issues. Complementing strengths and shaping competence. Complementing strengths is exactly that. Shaping competence involves a counselor complementing small successes along the way. Interventions for specific problems. Invariant prescription to sever coalitions. This is a directive that is not varied across the families because this one task is quickly severs inappropriate parent-child coalitions. Ordeals for compulsive behavior. For this intervention, the counselor prescribes an ordeal before or after an unwanted behavior. Ordeals are not punishment or behavioral deterrent. An ordeal simply disrupts patterns. Boundary making to increase or decrease engagement. Boundary making is a special form of enactment that targets over or under involvement to help families soften rigid boundaries or straighten diffuse boundaries. Examples: asking family members to change seats, asking one or more members to remain silent during interaction. Treatment planning, initial phase counseling tasks, develop working counseling relationship, diversity consideration, join the client, respect larger systemic culture, assess individual systemic and broader culture dynamics. Initial phase goals about 1 or 2. Working phase counseling task. Monitor quality of working alliance. Increase interruptions to problem. Clear interventions. Closing phase of treatment. Develop an aftercare plan and maintain gains. Reassess functioning. Intervention. Closing phase goals. Research and evidence base. Systemic therapy began as a research project. The Bateson team began by studying communication in families with members diagnosed with schizophrenia. The tradition of observational research has been integrated into required standard training in systemic and strategic models in the form of observation teams. Systemic therapies are quickly emerging as a leading force in the realm of evidence-based treatments. Ethnic, racial, and culture diversity. Because systemic and strategic family therapies do not rely on a theory-based definition of health and normalcy, they adapt relatively easily to different culture groups and subpopulations. Remember from a few slides ago, the counselor joins the family. This means they adapt to their rules, language, and respect their values, making this approach appropriate for different cultures and ethnicities. Hispanic and Latino clients. Of particular interest, two groups of systemic counselors have systematically adapted and used the approach with Latino and Hispanic clients. The Latino Brief Therapy Center at the MRI uses the non-normative and non-pathologic principles of the model to guide their work, creating unique meaning and interventions with each client, rather than rely on cultural stereotypes of the extremely diverse Latino community. Asian Indian immigrants. When working with Asian Indian immigrants, remember, intergenerational family structure, collectivistic value system, respect-based hierarchy, impact of modernization on Asian Indian families, actions before words. Sexual identity diversity. The following are 5 principles for adapting the systemic therapy approaches to individuals in the LGBTQ community. 1. Understanding heterosexism. 2. Counselor self-reflectivity. 3. Locating your position, transparency, and self-disclosure. 4. Client as expert and counselor as curious. 5. Connecting the wider systems. Adolescents coming out to family. First and foremost, counselors should be aware that gay, lesbian, bisexual, and transgendered youth have higher rates of suicidality, substance abuse, self-harm, depression, anxiety, and school issues, so it is important to monitor the adolescent safety and well-being. Counselors are invited to use the Devine's 1984 stage theory for the family process of coming out to help families negotiate this transition. Transgendered youth. Unlike gay, lesbian, and bisexual youth, transgendered youth often cannot hide their difference, and thus it is more likely to be a point of family discussion, whether the child wants it public or not. 59% of transgendered youth report negative parental reactions to their gender identity. Parental acceptance is important for transgendered individuals, correlated with adult life satisfaction and self-esteem.